Hi, this is Michael Jordan, President of our Labor and Strategic Accounts Division at MagnaCare, joining you today from our Tinton Falls conference room. Today's topic, will healthcare ever be affordable? In 2015, we spent over $3 trillion in healthcare. That's over $9,600 per person in the country, nearly 18% of our gross domestic product. Expected overall growth over the next 3 years is 5 to 6%. That bumps up in 2019 through 2024 to 6.5%. By 2024, we expect that we will be spending $1 on every $5 generated in this country on healthcare. Some additional facts that are not surprising: 1% of the population is responsible for 21% of the healthcare cost. Furthermore, 5% account for 50% of the healthcare spend. There is not one panacea or solution to all this, but there are many steps you can take to help your plan stay more solvent and grow reserves and maintain a healthy level of benefits going forward. Some of that is around self-insurance, which many of you have adopted. By moving from fully insured to self-insured, you remove margin, premium taxes, risk mandates, mandated benefits, among other things, to make your plan more affordable. Defined contribution versus defined benefit. The labor world has grown up living off of a defined benefit platform. On a go-forward basis, we believe defined contribution will rule more of the land by providing members with more choices and options around how they actually want to spend their healthcare dollars. Site of service will be important, focused population health. So let's get to that 50% of the spend being driven by 5% of the population. Reimbursement models are going to change. We've seen a land that fee-for-service has ruled. We're going to see a land going forward that's going to be more around the value-based reimbursement. So providers, whether it's a hospital or a physician, are going to wake up every day knowing that I'm going to spend my time focused on getting my patient population better. Beyond that, a thorough review of the SPD to make sure that where services are being rendered, they're being rendered in the most appropriate care setting. And lastly, an approach to healthcare, which you have not heard in this part of the country, but you will hear a lot more from us here at MagnaCare, and that's around an integrated delivery solution. And within that solution, we are going to get all the constituents that sit at a table. And that could be the member, the employee, or the patient, the hospital, the provider, the plan sponsor, all at the table, understanding what they need to do to ensure that healthcare becomes affordable once again and into the future. Thanks.